This is really a great pleasure for me to be able to introduce Dr. Carlos Dora, who is our keynote speaker. I think we all agreed immediately that he was the person we most wanted in the world, to do this keynote talk, and you will find out shortly why. But Dr. Dora is a physician with a PhD in public health. He is has worked extensively as a scientist and a translator of science into policy and impact around the world in a whole range of issues across a variety of positions at the London School of Hygiene and Tropical Medicine, at the World Health Organization Regional Office for Europe, as a senior policy advisor to the WHO Director General, Dr. Brundtland, and more recently at the World Health Organization, where as a health policy expert, he leads work on health impacts of sector policies, energy, transport, housing, extractive industry, and understanding the health impacts and developing the approaches to assess the health impacts of those different sectoral policies, and devising systems to manage risk and amplify benefits. Beyond that, and I have to say this is perhaps the reason why I think he is so perfect today, and I'm sure you'll agree in a minute, is that he has really been a visionary about how to bring all of these issues together for maximal impact and minimizing risk. I have no idea what he's about to say, but I'm trying to avoid having any risk of scooping it. But I have been a huge fan, having read much of what he has produced from the World Health Organization. I'm a very large fan of his visionary approaches to help us understand how to move forward, tackling multiple challenges to our health and well-being through multiple sectors in an integrating way. Carlos.
Well, Linda, thank you very much. This is, I come here to learn, so you may be disappointed. Really, it's a huge pleasure to be able to see this meeting of architecture and public health. It's something that I wouldn't miss in my lifetime. It's something that really I think is important, it's timely, it's necessary, and it's something that I think the world needs. And I will speak from the perspective of a user of knowledge and from the perspective of what questions I see are there in the field and what steps, and I admit I will speak as a public health person, this is where I come from, but with the wish to be looking at what kinds of questions, what kind of joint agendas, and how we can build something which is in the direction of making the connection. And I should immediately say that we'll be starting WHO project with many cities to look at public policies and how they reduce air pollution and improve climate resilience in a way that is pretty grounded in African cities, perhaps some Asians, maybe, hopefully, a Latin American city. And that's also why I came, because I want to see what are you doing. I was excited to hear about this business that you have this kinds of spaces in different cities of the world. I think there's the kind of stuff that we would like to connect with and to build the kinds of agenda, the kind of responses that I think people need in local authorities, in government, in civil society. So I'll run through a few things just to say, let's say where we are. One, you know that the world is urbanizing, and I lived in Rome for a while. In the Via Appia, when I used to walk there, I say, well, it's been here for over 2,000 years. So cities do lock in the kinds of urban development and space, the way the space is used for a very long time. Also, the world is aging, and whatever we build has to be within that perspective. You know, it won't be the same thing. I was a bit flabbergasted by the lift this morning that you have to put your number outside, you cannot change the number inside. I said, well, how does that work in an aging society? I mean, will we all be able to cope with that? The third point that I want to make globally in terms of public health in cities is that slums are there to stay. We don't expect there's going to be a decrease in slums, so we have to learn how to work with slums in ways that probably are better than what we've done in the slum improvement and UN Habitat and the Millennium Development Goals agenda, where cities still haven't quite got, let's say, the successes that we have in some of the more vertical public health programs, like not reproductive health, but child health and some of the other ones. So I think slums are there. And three is most people die of non-communicable disease these days. Doesn't matter that in public health, in WHO especially, we spend most of our time and effort in malaria and infectious disease. The reality is, this is where the big costs, the big challenges for families, for cities are. And the costs are very large. And in public health terms, we tend not to focus so much on the interventions that we know are cost effective, which are beyond medicines and medical technologies. And I think that's a big question there for us, and needs to, and I just listed some. I mean, comparing with vaccines, a number of these more environmental interventions would be very cost effective. Nonetheless, they're not in our priority lists when we are, and I'm talking about ourselves in WHO, when we're working with countries, this doesn't come first. Partly because of the lack of conversations, I'd say, between and across sectors, and that's why the conversation here is so important. Also, we don't spend any money on those kinds of interventions, so we don't see that. This is OECD data. A lot of our expenditure in the health sector is around treatment, etc. So there's a quarter of the burden of disease is estimated to be due to environmental factors, but we only spend a tiny proportion of the budgets in public health in those issues. And then the kinds of challenges that we have in cities like urban sprawl on the right are that you have in the States, in many parts of the States. You're repeating this, or we are repeating this in places like China, where people still are using, are developing a pattern. This is just transportation and energy, urban density versus transportation and the energy use. And from the energy point of view, and energy conservation and management point of view, the kinds of urban sprawl that are being reproduced in many parts of the world today are incompatible with our requirements, our ability to produce that energy response, and have many public health implications, which I'll describe in a minute. But really, we know that the way transportation happens and the way buildings are made and are built have a big implication. Our unit just released some new data from air pollution a few weeks ago, which is drawing a lot of attention. And that's, I'm bringing this here because I think we have to use when the doors that are open. I come from a rural area in the south of Brazil, I'm a gaucho, and my father used to do is the horse comes with a seal on the top, you just jump on it and you use it. And I think that's the kind of things that we have to be using, because people are concerned about air pollution in China today. And whilst they wouldn't hear, or we wouldn't open a conversation on climate change and mitigation or adaptation, they will respond very proactively to something which has to do with air pollution. So I think we have to, and that's causing a quarter or a fifth of strokes and of ischemic heart disease. So our responses to the urban environment, and this is indoor air, which you'd think is not an urban problem. Well, yes, it is. It is in many cities in Africa. It is in many cities in Asia. People still use solid fuel within the home, and that has a number of implications for energy inefficiency, but also for public health, which are very major. Costs of air pollution are large. A lot of the pollutants sources are the same as the climate change mitigation gases, and transportation and housing and buildings, again, are a very big part of that story. And here it says that in short-lived climate pollutants, the black carbon, the methanes, transport and housing again and buildings are a very big part of the picture. So we have good reasons to be looking at public health issues we also know a lot, and I don't have to say this to this audience, physical activity has major health benefits. In order to get population levels of physical activity in practice, we really have to be working around buildings and transportation. And just some of the benefits of cycling, which I'm sure you're well aware of, but it's like a panacea. It's great stuff. There's no medicines that produce all that that you could have from just using the space of the city or the way the buildings are constructed. They have easy stairs, and as we know, and as New York has produced with Karen, information on that, we know that we will have a lot less disease. The shape of the urban environment has direct links to injuries and injury prevention. The more you have sprawl, the less you have cycling, and the more you have accidents and mortality on that. Similarly, we would say that we have to create cities and a vision for cities which take those things into account. Unfortunately, so far, this is the food agenda, which again, I won't go very much here because I'm sure you're very familiar to that in this country. But access to healthy foods is the basic determinant of being able to eat healthy food and having a healthy diet. And if you don't have that, if your cities are constructed in a way which avoid that, then you just won't. And there's a reasonable amount of evidence on that in terms of that there are studies. It's not that the public health community has been oblivious to those aspects. Now, what are the opportunities? And I'll raise 3 points here, because somehow this conversation, I think, for me, what's interesting is where are the common questions? What are the kinds of things that give you anxiety and make you think and you like to know? And which are the ones that we have, and where are the common ones? And where we can create a common agenda. And some of them on our side, on my side at least, are to do with transportation systems, with housing and buildings, and with energy efficiency and power generation. And there are a number of experiments, as you've been. New York is a great experiment, but you have Bogota in Colombia with BRTs, which have done a great job in terms of reducing. There's a limited amount of evidence in Bogota still around how much air pollution was reduced, how much more physical activity. There's a gap in the response of the scientists to really document the benefits. I think we're not there yet. But the opportunities are being built. And we're just talking about Rio just now, and they are building BRTs. That's an enormous opportunity. It has good schools of public health. You have a center there. So I'd say those are the agendas for today that we have to respond and to embrace. And what Bogota has done is much better than this. This is just the picture that I had. But the fact that they use also the people who live in the slums near the BRT to work on the BRT. There's a social element. There's a physical, the physical environment, taking care of the runoffs of oil, etc. So it's a complete package, and which has great lessons. And I think Latin America has been leading on that. So I think sustainable transport is one of those panacea things, one of those great responses that public health should be doing more work. And we've just spent some time looking at what evidence there was for research, and we were pleasantly surprised to see that this is from kinds of sustainable transport, more active transport, more use of public transport, a lower use of cars. And on the left column, you have studies showing improved health outcomes. And on the right, you have studies that showed worse health outcomes. So this is not a systematic review, but it shows you there's many more studies that are finding benefits from those 3 ways of having sustainable transport. And that's already good evidence. It's not enough to do a systematic review, but it's a very good evidence. It's the balance of evidence. And so we call this scoping reviews. We've been doing a lot of those reviews as a critique for the IPCC. Because the IPCC, as you know, has put out recommendations for reductions of CO2 without any other considerations about co-benefits or tri-benefits, Linda would say. And we just came up with a series of critiques, constructive critiques. They say, well, where is it the IPCC got right in the terms of public health, and where is it that it got it wrong? And I think that's a responsibility of the public health community. We have to roll out our sleeves and come up with those kinds of public policy statements as being said by that. And just to come up with what are amongst those that protect public health. So this is one example, is transportation, because I've been working more with that than anything else. This is a summary. They forgot that rapid transit was a good idea and no motorized transit existed, and that could be a strategy for climate change mitigation. And the whole emphasis is on technologies, better engines, better fuels, which are good. I'm not against better engines and better fuels. But that's, if you look at the whole picture, you see that the balance of the benefits should be much better. I expect that the next version of IPCC would have addressed some of these issues, which is coming out very soon. Housing is the other issue that we're now doing WHO guidelines for housing and health, which is similar to LEED is for environment. And we're struggling enormously because we have a very good group of people. We haven't managed to get any architects engaged so far, but I'm pitching here to the architects group to contribute. But it could be a very exciting way of informing local authorities, civil society, anybody who's working in the built environment around what are the risks and benefits. And the kinds of things that we talk from building materials, China still uses asbestos in their constructions, big way. There are things, there are leading pipes, there's things which are very well-known public health risks, which are still being built into cities that will stay for, tens of years or centuries in that place, and we will have long-term consequences. So I won't go a lot on housing, but I do think there's one of the things that we could easily, there's actors there that could have a role, people who let houses, who buy houses, who construct, the architects who plan. There's many people who could appropriate this kind of information. It's just a matter of packaging what we have and putting it forward. Of course, you have been doing green roofs and other things in New York, which is exciting. Many people are not yet there. And I think that's one of the things that we should be anticipating, because of climate change, we all need to adapt and addressing that. So what we need, I think, is a vision for public health that draws more on those kinds of interfaces. And this is just a nice picture of a slum improvement in South Africa, where these women are, they did a bit of building insulation, rainwater harvesting, this is Johannesburg, and solar heaters, hot water heaters, gardens, small gardens. This is a slum, so this is the space is not very abundant. But I think this is the kind of solution that we should be looking at to address issues of urbanization is problem. So what is the transformation? I do think we need a transformation in public health from that perspective. We're very good on a number of disease issues and reproductive health, child health, and we've done very well. But in terms of the urban environment, there's this awareness over a long time, the focus on process on healthy cities. But I think we still have a long chemin à bâtir. I have a long way to go and have a lot to build in those terms. And I would say, I'll put a few things, and the first one is research. And I am aware that I'm talking to a faculty which is, eminent and very important. But we do miss research which looks at interventions. And I'll give you the example of air pollution. We have hundreds, literally hundreds of, thousands perhaps, of studies on the impacts of air pollution on public health. And we have a handful only globally, and most of them are very old, about what are the results of interventions. I mean, that's absolutely appalling, because we do have easy ways to measure air pollution. There's short-term diseases that happen in response to air pollution that we could be measuring, documenting. And we've been using all that energy to look at the detail of what is the disease and how much air pollution, which pollutants and where do they come from. But that effort has not gone into the interventions part. And intervention research, I think, is number one, because at the moment that you create any big study, the 60-city study or the Framingham study or anything that is iconic and makes the point to a broader audience, then we have already half of the way constructed in terms of finding the solutions. So research, number one, overall. And I think I would be interested to see that these kinds of outfits that we have in different cities across the world would address research and implementation research, first of all. The second thing is putting that research in ways that are easy for people to use. And we have a lot of that stuff in WHO. We do air quality guidance, water guidelines, noise guidelines. That's why we're doing housing guidelines. We're doing energy guidelines. Vijay is right in the back. And because we know that different energy technologies have different public health performance. Now, we have to come out of the woods and say that in clear ways and address that as very clear questions and different options that people have. And it's the same point. The third is a little critique on cost-benefit analysis, which seems to forget completely public health in many places. And this is a critique for my friends at the World Bank, who do their decisions for transportation without looking at many of the things that we call co-benefits. And I think it's quite appalling that they still do that. So I've showed that to them every time I have an opportunity to meet with them. And I think that's one of the things that health has so many costs and so many savings. We have exceptionally good data on healthcare costs across the world. We have a global database. We can really show results in public health terms very easily if we just put, and that completely changes the cost-benefit analysis in transportation. Completely changes. If you don't have health, as is the case of the main model, which is used still by the bank, in part of our hammering and we've done this little thing here, which some of you may have used, which is just a spreadsheet. We did a systematic review of the studies that look at investments in cycling and investments in walking in a city, and what are the public health benefits. And you can use it. You go there on the web, and people use it. It took a few years, to be honest. Until we thought and we got people together. But it's the kind of tool that it is a cost-benefit analysis. You're still looking at the world in an utilitarian way. It's not the only way, I'll stress. It's not the only thing that you should be doing to make decisions. But the fact is that it can make a big difference, that you can just draw something from the web and make a point about the benefits and estimate the benefits in your city, what would happen if you were have more cycleways or my pedestrian areas. The third thing that I think only we have is health impact assessments. And I know the US has been moving on that, but I want to make a point here. Social and environment impact assessments have been around for a long while. The health impact assessments have taken a long time to come up to that. We should be engaging with that. And it's because it's unique, partly because it looks at people's perspectives. And then it also uses the science base to document what are the risks, what are the benefits, and to quantify them. But you're not starting only with a narrow quantification. You're looking at different perspectives. And I think, and those are some of the areas that I think we should be, the sort of urban policies that we should be doing health impact assessment of, different policy options to inform public decision, to inform stakeholders about that. And I've just mentioned some of the benefits of doing health impact assessment, some of the reasons why you do. You inform policies, you have the positive as well as the negative impacts. You have create mechanisms for public participation as part of the impact assessment, which I think is excellent. You have to necessarily work across sectors, because if you don't understand the policies that are options from the other sectors, you cannot produce a health impact assessment. So it's part of the methodology to go there and engage and learn before you start documenting any of the, and it creates a framework for monitoring and tracking, which is my next point. This is not a city, you know, it's just that we have been using health impact assessment in a strategic way. if you look at the whole range of strategies, this is a paper mill. So this is a conflict between Uruguay and Argentina, which went to the International Court of Justice. And it was addressed by a health impact assessment, just to understand what are the different perspectives, what is the evidence, and to put the whole package together. So I think it's a great way of finding those solutions. Development banks have some sense of that because of the risk management story. And I think that's one of the other low-hanging fruits. The fact that businesses like risk management, understand risk management, I think is one of the things that we should be using more. Health and understanding health and disease is a lot about what are the risks, but also how you can manage the risks and what you do the benefits. So I think that's one of the things that we should do. Just as a parallel that EIAs and social impact assessments have the same kind of structure of a health impact assessment. It's very easy to plug that in. The fourth point for action, I think, is tracking and building accountability. We live in a world of big data. It's not difficult to get hold of data. Perhaps the step that has to be done is just putting the data together in a way that addresses the kinds of questions. This is what we have at the moment, for example, in air pollution. We have cities, levels of air pollution. Is disconnected from where it comes from and what it causes, right? That's one item monitoring. What I think we'd like to see, and I'm giving again a transportation example, is to be able to document policies. Where is the investment? Where is the money? Where is the policy? Where is the enforcement? What are the kinds of results of those policies in health determinants? Physical activity, risks of injuries, air pollution, job opportunities. And then what does it mean for the proximal risk factors, which is not one and the same thing as the determinant, and then what it means for health and for health equity. So I think it's a slightly more integrated idea about what is it that we have to track. Of course, this is very much on my mind because we're working the Sustainable Development Goals for the UN, and there's lots of debate, and I don't think the cities debate have been very well resolved yet. Certainly the health issues have not been integrated in a way that as much as I'd like. And I think that's a way of looking at trends, and the kinds of things that we document and measure are the ones which are really going to, this is just, this is the kinds of things that I would like to see in the monitoring system. The financial flows, the sector policies, the institutional settings, the human resource capacity, the use, and this exists, right? So it's not my dream. It exists for water and sanitation. It was created in response of the MDG indicator 7 for water and sanitation. We started, this was done in WHO with UNICEF, we started looking only at the improved water system, so the improved, first only at the policy side. And we realized that a lot of the water was still contaminated. So after a few years and a few iterations and a few studies, we realized that we needed a more complex system, which exists now, and that's what it encompasses. I think this is a great example for other public sector areas like transportation, or like cities in general, that we could map out and track some of those, and this is the example of water, the first publication of that report in 2010. I won't bore you with this. This is the same thing as just saying that it happens at the national level, at the local level, and the global level. We have that understanding of policies and outputs at the three levels. This is one example of what we've been trying to push in the Sustainable Development Goals debate around the indicators, creating health indicators for sustainable development. There's a paper coming out of the Lancet pretty soon. It's been accepted, which says that, proposes that. But as I said, I think we need a bit more than a paper in the Lancet. This is a WHO report on that same thematic area. I think that needs much more of a push and much more of an articulation, and I would be interested if anybody is engaging with that. The sixth item is communication, and the fact that we can communicate about those things in ways which are easy to understand, and I'm sure architecture knows a lot about that. So in synthesis, and I'm finalizing, I'm justifying that why is it that governments and people and us and experts should be taking action? And the first reason is utilitarian, and I've used before, is a sound economic decision. Why would you not use the evidence that exists about health's risks and benefits in the context of your policy making? It doesn't make sense. It doesn't make an economic sense. And that's why banks do invest a lot in risk management when you invest in any project. The second was use of existing knowledge. The third one is close to public health, and I'm sure for architecture, is to give a voice to people who don't have a voice politically. Children, perhaps elderly, perhaps people who are outside the system. So somebody has to come up and to say, well, these are the issues, and this is what we should be doing because of a reason X or Y. And that has also an implication for equity. We all suffer the consequences. We all have a concern, and that's a way that we, by constructing this analysis of the evidence in ways that inform us about the equity issues, that we can also be contributing to resolving this. I've given you my 6-point agenda. This is a summary of those 6 points. And I'll finish with just some images of the future. I do know that architects like plans, and I love them. I love architects, and I love plans as well. And I think we haven't perhaps been making use of these kinds of visionary capacity of architects to imagine a space that is going to be in the future. This is taken from the Foresight project, which you might know in the UK. They had a number of futures exercises looking at different sectors. This is the transportation one, because I had the images they also have for food, for other things. And it's the kind of effort that I think we should be doing much more, and that's perhaps one of the commonalities around architecture and public health, is look at these future visions. And this is transport in a London city as it was today. This is one alternative, vision one. You have some electric cars. You know, you're not having any public transport, but you're going for technology improvement. That's vision two. You're privileging public transport and cycling in some green areas. And vision three is mostly no motorized transport, which may be working well for a city, for a road of that size. So the fact that we can articulate, this is a complete one with mostly non-motorized vehicles. The fact that people, decision makers, civil society, can look at those futures and think of those as healthy futures, and what are the implications, the consequences of that, I think bring a lot of meaning to the kinds of policy decisions and proposals that we have. Because it brings a narrative. People can deal with it. You can talk about it. You can start understanding what would it be like. And in fact, a lot of the transportation interventions which were successful, they were done on a weekend, like a coup d'etat or like a revolution, if you want. Because it takes a while to engage with a new vision. So perhaps there's more different ways of creating that revolution, which can be also conceptual in terms of discussion, in terms of debate. And I'll finish with that, with the visions. What are the visions that we can create, and how is that we can learn from the visions that architecture has that can relate to public health, and how is it we could perhaps do some health impact assessments of the different alternatives and look at the future in terms of public health benefits that would encapsulate and would create a joint vision. Thank you for the opportunity, and I look forward to the discussion. Thank you.
So, would you have a seat with
Sure.
me? And Carlos, that was fabulous. Thank you. A great framing, a great start. We're just going to take a couple of minutes to just kind of think about a couple of dimensions I'd like to poke at, if I could, about what you just said. So you're talking about why many sectors of society, globally, nationally, regionally, who don't normally take health into account should. I'd like to throw in one other comment that I've been engaged in, and then think about ask you to help us think about where the responsibilities lie at different levels. So I was recently in some discussions in China that were fairly high level, in which seems to be, and you work a lot in China, there seems to be a growing appreciation that the emergencies of the health impacts of environmental degradation and the distress of the population could actually propel action on environmental pollution that has been hard to achieve previously when the health effects were not apparent. So there are many loops that, of course, that bring these together. But it raises the challenge of how, because in so many of these things, both the right framing and the right sense of urgency matter. And from a public health point of view, prevention's the only game here, right? In so many of the issues. So we're confronted with a number of things where we could do better, but a number of silent emergencies as well, as I like to think about it, where acting on our environment and acting on our health are both critical. We have the opportunity in cities that they will be about 50% of cities are just naturally turned over in the next 30 to 40 years, and a silent emergency. Who's responsible for what? At the global level, at the national level, at the regional level, and how do we align those?
Right. Well, thank you for the question. It's a good question. It's an excellent question. I'd say, first of all, I don't think people are evil, and this, primarily people want to create those bad environments. I mean, you're mostly worried about your greed, or it's all proximal. You don't see the long term. You don't see the implications, and many times people don't know that. One interesting thing that happened in China is an equivalent of your National Resources Defense Council outfit, where lawyers came up with environmental scientists to produce some high-profile cases to bring attention to the issues. And I don't know if you've met a person, there's a small man, very bright, Chinese, and he's been training environmental lawyers to do that kind of work, to work with communities, with municipalities, etc. I think when I last met him, he had trained 450. But China's a big place, it probably needs more. But I think, and I'm saying that because it's using the information that you have in a way that is strategic and that will make a difference. And the fact that researchers have that information and have the ability to put questions. I mean, the formulation of questions, I think, is essential. I mean, of course, people who fund research have more of an ability to define what questions get funded. But I think the articulation of the questions and around the kinds of things which are worrying people. And I think environmental disaster is one of the big things in China. I think even more, air pollution is today an environmental disaster, which in front of, in everybody's noses, in everybody's lungs, and in everybody's minds. And businesses are paying a premium to, send people to China because of air pollution concerns. So I'd say that air pollution today, and those who do air pollution research here, Vijay and others, should be engaging with that. And that's the right moment to do that. And what I was talking about when I started with is working with cities, especially in Africa, but also in Asia, around public policies. We're going to use air pollution as an entry point. So being astute in terms of where are the entry points today, where are the emergencies, how do we help people where they are, with the kinds of knowledge that we have, which doesn't have the same frame. Because we came from a different frame, or we come from an understanding of disease and health, which has a broader range of connections. So that interface, and the people who do that connection, I think are crucial. And for today, I certainly think that listening from the perspective and the ways of framing and the social representations of what's going to come out from the architects are probably a very good lead way.
So, thank you. So, I'd like to take one or two questions from the audience just to start the idea of conversations, and then we'll continue them through the day. Any comments or suggestions or questions? Yes. Here. Here, go ahead. We'll see if we can get this to you.
Oh, so I come here. Maybe it's easier. So thanks for your presentation. I was curious about these last visions you showed us, and wondering if you could imagine, maybe are the ones that more clearly speaks to me as an architect, thinking, because what we always see in these visions are drastically going in one direction, like, okay, public transportation or biking or no motorization at all. It's like they are very like taking one direction and trying to figure out these visions. And probably what we, from, let's say, from an architectural point of view, we also like complexity. So I'm wondering if you could imagine, let's say, for example, São Paulo, you know very well, that highway that is actually transformed in a pedestrian place, but during the week is not, is a highly car system, and in the weekend and night become another place just for pedestrian and change totally the social. So I was wondering if you could imagine that. I understand very well that this could help the conversation because it has a narrative, and so everyone could understand it. But you could imagine examples where there is a much more kind of like complexity in the users or in the decision making.
No, I agree completely. I mean, the point of crystallizing some potential scenarios of where to go and with different levels of complexity, etc., is to open the conversation. What my sense is difficult to think very much about. I mean, you're more used to that as architects, but most people don't necessarily think in terms of the future or what it would be like if we do it this way or the other. It's part of your profession. We're much more on the response mode. People arrive with a disease and you have to deal with it and to help them address it. I mean, those of us in public health, I mean, think more of a... So I think the visions and the Foresight project overall, I think has been very helpful in the UK, is that you produce a number of alternative visions, a number of alternative scenarios, and you look at the different implications for jobs, not only for public health, but for jobs, for quality of life, for other things. I think that enables a discourse and a conversation. And specifically, I think public health has a role in health impact assessments, doing some of the health impact assessments, those kinds of scenarios, to see what would be like, what we expect to happen. And because we can also quantify, we can do some costs and some savings, we can do who would benefit, who wouldn't, can describe what we anticipate in terms of inequalities. We could produce our contribution in an easy way. So I think that was more that, but it's an opening of the conversation rather than, and I agree completely with the complexity is where the beauty is.
Elise, yes.
Thank you, Doctor. I just wanted to ask you, on your slide, you actually wrote equity in policies, and I'm more familiar with saying health equity. And when you break it down into policies, it goes back to, I think, Dr. Fried's question about who is supposed to be the driver, since policies are oftentimes government stimulated, legislature involvement. I'm from New Jersey, so, you know, politics is very strange. And so it's not really an international joke, but I think we get that in New York. And it just troubles me because many of the policymakers are concerned about the stakeholders who elect them, if you will, and not about the disenfranchised people who will have to suffer the effects of those policies. So thank you.
Very good point. I think until the disenfranchised become an issue, and I think that's where the public communication, how do we frame issues, how do we what are the social representations of the various issues in society. If it becomes a problem, then that's when the problem. I think we have to have something always for the normative people, for the I think that's essential. It's part of our role. But I think we also have to empower other groups, civil society groups, etc., and to make it visible. And in a way, I do think that public health renders legitimate the plight of the poor, of the disenfranchised, etc., because it sort of gives it a name, it gives it a face, it puts it in. So I think we have to be, is our part of activists in terms of the work of public health, what it is. But I think we do have that responsibility as well. It's not only one audience we're talking about, and whenever we produce our research, I think we have to make sure that it's usable by different groups. And I certainly think that equity, I think, is not so much anymore, perhaps in many places, an issue which is left behind, because inequity is something which is important for the economy. And people in many places, I'd say, see that as a threat to social stability, including China. And what is it they call it? Harmonious society. That was the name a few years ago. But it's a threat to a harmonious society. And I do think that the more we show the inequity issues and the better we clarify what the implications are, in transgeneration terms, what is inequity for the children who are born in inequitable homes, etc., in terms of early child development. So I think there's narratives that we have the ability or the power to make them public and make them usable by other people.
Wonderful. So this is just the opening shot and many more conversations, but I'd like to turn the podium over now to Hilary Sample to introduce our next panel.